Whoa, here we are, first day. That's everybody over there. That's Val, he's one of the doctors. That's Igor standing behind him, and that's Barry locking the door. And that's me here, having had 4 meltdowns just in the morning, which I always do when I come on these trips. I think I get anxiety the first day because I don't know what's going to happen. But it's beautiful here. Look, this is where we stayed. Wow. All right, but now we go to the hospital. This is what we're here for, and this is when it really does get fun. And then I stop getting nervous because there's something to do.
Can't go anywhere without the driver.
No,
That's for sure.
There's Val. On the way to the hospital.
Hello. Oh, we're going in the back, right?
Yeah. This is the hospital. So here we are, going into the hospital for the first time. Hi!
In this hospital.
Wow.
We only have X-ray
X-ray.
and the old one, not computer. Not цифровий, not
Just a plain X-ray. That's
Plain
all-
X-rays is all they got.
ultrasound.
Ultrasound, you have that?
It's clinically based. It's not based on gazillion studies, $1 million workup for every significant or insignificant
Right.
disease.
You must see our
Literally, yeah, it's like it was years ago, where
That's correct.
it's you touch them, you look
That's
at
when
them.
the old
It's
doctors were able to diagnose diseases without having any imaging studies.
you know why? Because
I know.
medicine is an art form.
It is. It
Don't you
is,
think?
it is.
It's an art, not a science.
I always give an example of Nemanov is a Russian who, with fluoroscopy, had diagnosed. He actually, this is a symptom of a confocal cyst. When you take a deep breath, it distorts under fluoroscopy. You can see it. So that was it was named symptom of Nemanov, who is a Russian guy who described it. However, about 100 years before him, Dr. Gray in Brazil had described the same symptom using percussion. So he was able to sense the distortion of the cyst with percussion, an art that has
Wow.
long since been lost. So.
Wow.
men's and women's separately.
Yes? Men, this is women's, like a women's ward.
Добрий день.
Добрий day.
Знімати
Добрий
відео.
day. Добрий day.
Okay, be here.
Acute appendicitis and descending, what to do right here.
The way the system works, it's mostly the word of mouth.
That's how they find us, is word of mouth? They hear about the hospital, they hear about MMFC, or both?
No, both.
Both.
Тянеться, от воно то не тянеться, але от воно іде, я пробував тут обпилювати, щоб нитку зачепляло.
Ти пробував для ти.
Trying to modify. This is a Verus needle.
What kind of a needle?
Verus needle.
Вирішення to make a...
Verus needle is for to inject CO2 into the peritoneal cavity for laparoscopy.
Here's a stupid question, is you can't buy these needles here?
We haven't the magazines or medical equipment magazines where we can...
Not magazines. He meant stores.
Stores.
Where we can get it.
So you don't have to really understand, it's like, what do you mean? Why don't you buy one? What do you mean they don't exist here?
That's exactly
No.
what they mean.
What's his name again? Bogdan?
Bogdan?
Bogdan. He was saying that Ukraine is not a poor country, but
Yes, not poor,
but none of the money comes to the
It's not
people.
poor, but it's not rich either.
Right, but even if it's whatever its money has, it doesn't come down to anybody, right? No one,
Yeah, there's no trickle down effect.
no
if
trickle
that's
down.
what it is.
Yeah, that is what kind of I'm asking. Yeah, none.